Bronchodilators. Hello everyone, I am Salcedo and I am going to discuss what bronchodilators are. But first, we need to know what bronchodilation is. What is bronchodilation? Bronchodilation is the basic pharmacological action that is required to treat airway disease and other related conditions. Now, let us know more about what exactly bronchodilators are. Bronchodilators are a class of medications that act on the bronchi to relax and open the airways in the lungs. It is a substance that dilates the bronchi and bronchioles, decreasing resistance in the respiratory airway and increasing airflow to the lungs. Also, bronchodilators require a prescription from a certified medical prescriber, for it is not recommended for patients to take herbal products, over-the-counter solutions, or homeopathic agents advertised to mimic the action of the bronchodilators because the FDA does not approve them and their effectiveness is questionable. Bronchodilators also treat several diseases such as chronic obstructive pulmonary disease or COPD and asthma. The drugs which induce bronchodilation also reduces inflammation. Bronchodilators are divided into short and long-acting groups. Short-acting medications provide quick or rescue relief from acute bronchoconstriction. Long-acting bronchodilators help to control and prevent symptoms. There are three forms of bronchodilators. First is the inhalers, syrup, and tablets. So there are different inhalers. First is the metered-dose inhalers, which are contained in a pressurized canister that the patient presses down to trigger the propellant and release the drug. Next is dry powder inhalers, which are in powder form and there is no propellant in it. Soft mist inhalers have no propellants and deliver the medication in the form of an aerosol cloud. It is longer lasting and slower moving than metered-dose inhalers, which means more medication is delivered to the lungs. Lastly, the nebulizer, a liquid form of a bronchodilator that is dropped into the nebulizer cup. Then the patient inhales the medication from the mouthpiece while the compressor of the nebulizer machine is on. The two other forms of bronchodilators are the syrups and tablets, which are taken through an oral route. The diagram above shows the classification of drugs that are used for bronchial asthma. First are the bronchodilators. Beta-2 agonists. These medications block the beta-2 adrenergic receptors of cells, which result to relaxation of the smooth muscles that surround the bronchi. The patient's shortness of breath is usually resolved with the use of beta-2 antagonists as bronchodilators. Salbutamol and terbutaline are one of the examples of the beta-2 agonists. Next are methylxanthines, which are a long-term control of asthma symptoms. The most common methylxanthines are theophylline and aminophylline. Lastly, for the bronchodilators are anticholinergics agents. It blocks acetylcholine's constrictive action on the bronchial tubes. As they block the chemical, The airways relax and allow air to get in and out. Example given are ipratropium and tiotropium. Other classification are the leukotriene antagonists. The examples are montelukast and zafirlukast. Next is the anti-IgE antibody. Example drug is omalizumab. For corticosteroid, there is two types, the systemic and inhalational. Lastly, mast cell stabilizer. Examples are sodium chromoglycate and ketotifen. Bronchodilators differ in their mechanism of action, how quickly they work, and their duration of action, their uses, side effects, as well as how they are administered.